Now, there it is. Thank you very much. And
Okay.
now we can see you as well.
I've pre-recorded the presentation, so I'll run it now, and I'm happy to take questions afterwards.
Thank you very much. So it's all yours. Thank you
Thank
very much, Caroline.
Thank you for joining me. My name is Caroline Moos. I'm an Australian and I work in Denmark. I have a background in public health. I'm pre-recording this presentation to make sure it goes smoothly, and I'll be available for questions after the presentation. I work for SHE Network Foundation. SHE stands for Schools for Health in Europe Network Foundation. The Schools for Health network has existed since 1991, but in 2018 they became an independent non-governmental organisation with the name SHE Network Foundation. This network consists of both member countries and a research group. We have 40 member countries from across the WHO European region, and in 2020 we welcomed 3 new members. From our research group, we have 103 researchers representing 28 different countries. The network provides inspiration, advice and collaboration. For example, these members meet annually both at an assembly and have an opportunity to participate in an academy in relation to school health promotion. The network provides tools for school health promotion. For example, there's a manual for schools on how to become a health promoting school, and there are also materials for teachers in relation to health promotion. The network also shares best practices. The newsletter, which is produced 6 times a year, often publishes stories from teachers telling about their approaches to health promotion at their school in their particular setting. It's important throughout this presentation that we have a common understanding of what a health promoting school is. SHE defines the health promoting school as a school that implements a structured and systematic plan for the health, well-being and the development of social capital of all pupils and of all teaching and non-teaching staff. We're talking here about a whole school approach. The whole school approach is when we regard the whole school as a dynamic system of intertwined components which work together to promote health and well-being. In the diagram to the left, you can see 6 individual components, and it's important that the school has focus on all 6 of these components when focusing on being a health promoting school. So a whole school approach is not only about, for example, students' individual health skills and action competencies, but it's also about the school's health policies, their links to the community, their physical environment and social environment, and the services they can offer to students. SHE would like every school in the WHO European region to become a health promoting school. And in order to do that, it's important we have collaborating partners. I've listed some of our collaboration partners here to the left, and we would love to hear from you if you're interested in becoming a partner with us. We are funded by a variety of different organisations, but primarily the EU, with support from WHO, from UC-Sud, research institution member countries and some other institutions. This year, in 2020, our network has facilitated 4 different working groups for interested members. They have collaborated together to produce a variety of different materials and tools on school health promotion. The first group worked with materials for teachers, with the theme School Health Inequality. The second group worked on fact sheet number 6 with the theme Health Literacy, and have also produced an animated video to support this fact sheet. The third group has piloted our standards and indicators for a health promoting school. And based on this pilot, the results of this pilot, these standards and indicators will be revised in 2021. The fourth group has worked on compiling a monitoring report on the status of health promoting schools in SHE member countries. Our research group is a consortium of researchers and research institutions, all working together to support the development of school health promotion. In 2020, the SHE Research Group planned and launched working teams with the following themes: health promoting schools and the whole school approach, implementation of health promotion in schools, health learning and health education, methods, physical activity, sedentary behaviours, physical literacy, nutrition and lifestyles, school staff, mental health and wellbeing. If you're listening to this presentation and you're a researcher or interested researcher, you can find out more about joining our research group by finding our website, schoolsforhealth.org, and clicking on the link About Us. And under About Us, you can see a link on the research group, and further down, how to join the research group. There are different forms for membership, and you can read the details here. And if you're watching this presentation and you're interested in the materials we produce, or you're a teacher or work at a school, you can access our free resources also at our website, schoolsforhealth.org. Click on the link Resources, and then the following link, Materials and Tools. And as you can see on the right-hand side, there's a variety of different tools available. This is all free and easy to access on our website. As this network works throughout the WHO European region, we need a common language, and English is used as our common language. But the network would like to publish as much material as possible in a variety of different languages. I've listed some of the languages that the material is published in on this slide. For the Spanish speakers, the SHE School Manual will be published in Spanish at the end of this year and also available on the website. So if you're interested in knowing more about the SHE Network Foundation, you're welcome to look at our website. Our website will list the contact details of your country's national coordinator or regional coordinator. But if your country doesn't have a national coordinator, you're welcome to contact us, registering your interest or curiosity. Mostly national coordinators are appointed by the Ministry of Health and/or the Ministry of Education in that country. Anyone can use the materials that are developed by the SHE Network Foundation. The materials are available on our website, and I've showed you in a previous slide where you can find these materials. You're welcome to use them, and we welcome feedback on these materials. If you're a researcher and you're interested in joining our research group, you're welcome to contact us. Again, our website will indicate where and how you can join. If you're not a coordinator or a researcher, but you're still interested in knowing more about health promoting schools, you can follow us by doing the following. Join our social media platforms, either Facebook, LinkedIn, Twitter, or YouTube. Alternatively, sign up for our free newsletter that comes out 6 times a year. Find our website, schoolsforhealth.org. click on the link Newsroom to subscribe to our newsletter. You're more than welcome. As I reach the end of this presentation, I'd like to thank you for your interest in SHE and the opportunity to participate in this online conference. If you have any further questions or queries about SHE, I can be contacted at the email address on the top left-hand side of the screen. Otherwise, as just a reminder, you can find more about us and access our materials and tools at our website www.schoolsforhealth.org. Thank you for your time today.
Okay, thank you very much, Caroline. And we have a few minutes before the next session, the next participant, sorry, for maybe some questions or doubts about it. Would you like to open a bit for the question, if there's any?
If there's any questions, they're welcome to ask. I'd like to add that there's also a Spanish translation of materials for teachers that is available on the website. So it's not only the manual on how to become a health promoting school, but also materials for teachers, which is useful for the Spanish speakers. And I would also like to add that membership to the research group is free of charge. I didn't mention that in the presentation. It might be relevant for some of our listeners. Thank you.
Thank you very much. It's indeed important information to share. Thank you. I'd like to profit that for the moment there's no question about, and I would like to know a bit more about if there's any way for children to participate somehow, or if their views or voices are somehow transversal or in some manner in the work that you're doing, any of you, or maybe in the platform itself, the network itself. Thank you. I don't know if
your question's very relevant. In both our values and the pillars, the core values and the core pillars of our organisation, participation from children is vital. So it's ironic at one of the first questions asked specifically about that. In relation to working with school health promotion on a policy level, and at the level we work with, we're aware that we need to involve children, but it can be more difficult from a practical perspective. The assembly where the national coordinators meet once a year, and the capacity building workshop we also provide annually for coordinators and researchers, have spoken about recently and have made steps to try and involve children in some of the presentations. But COVID's been a problem this year, so it hasn't been easy this year, but I think the intentions have been there. It just hasn't been able to happen in practice yet.
Thank you. I thought so, and I thought that probably the year we're living, it's a challenge even even more. But it's really nice to know that that's included in the spirit of the network as well. I think that's very good. It's very interesting.
We have also developed standards and indicators for health promoting schools, and these standards and indicators have been piloted in schools. So although it's not a direct involvement of children in the network, the piloting of these standards and indicators in schools, children are involved in a more second-hand way. But it's certainly something that we're very aware of, and I couldn't agree with you more that it's very important.
Thank you, Caroline. So we open again for maybe any other questions or doubts, and otherwise, if you would like to add something else, it's also welcome. Thank you once again.
Thank you for joining me on a Friday afternoon.
Yes. Thank you to you also to be here on a Friday afternoon and participate active and interactive with your presentation, which was really, really good and clear to get to know to this network.